Welcome back. Now, over 70% of drugs and medicines sold in the East African community are imported. Regional manufacturers are operating at a cost disadvantage due to their scale, expensive asset base coupled with obsolete technology. In tonight's edition of EAC Integration, Betty Kiptum highlights how the EAC Regional Pharmaceutical Manufacturing Plan seeks to reduce imports.
East African Community member states spend $5.3 billion on pharmaceutical products annually, 70% of them imported. The EAC Regional Pharmaceutical Manufacturing Plan is seeking to reduce imports to less than 50% and support expansion of product portfolio of EAC farms to cater for more than 90% of ailments.
Africa continues to lag behind in adoption and use of technologies to solve African health challenges. In particular, the mining and use of data, and big data at that, is quite wanting. This is a tragic situation since Africa does not lack talent. What we lack is a structured way of doing these things that fully and purposely engages especially young people with talent.
Manufacturers in EAC are strongly present in the anti-infectives product category, but they miss out in immunological and cardiovascular categories, which have a larger market share in the region. Even though locally produced medicines cover 66% of ailments, the region faces capacity challenges in manufacturing advanced formulations.
In order for the EAC pharmaceutical manufacturing sector to capitalize, we're working consistently on quality standards to build customer trust and confidence. And the EAC domestic pharmaceutical manufacturers should utilize the EAC Medicines Regulatory Harmonization Scheme.
We have to ensure access to affordable medicines and medicine products for our East African community citizens. It's a process towards 2050. And we have to work together in an integrated way, mobilizing all stakeholders so that we can actually build synergies and achieve the best we can achieve.
From the trade perspective, Desai says enhanced integration would reduce regulatory barriers and broaden export markets.
Building that capacity for an end-to-end ecosystem as far as a supply chain to work together, to collaborate together, to synergize, and to share opportunity because of volume is absolutely a fundamental issue. And that way, we'll be able to reduce the biggest concerns we have: cost, time, and transaction efficiency.
The plan targets to have at least 5 companies in the East African community producing more advanced pharmaceutical formulations, such as small volume injectables and double-layered tablets. The COVID-19 pandemic exposed the need for a strong supply chain framework, both locally and regionally. EAC member states are now looking to ensure that at least 50% of the health product imports come from the regional bloc. How can they do this? It means ensuring that a strong manufacturing sector is in place and that the supply chain is efficient. Betty Kiptum, Prime Edition.